Okay, good afternoon, everybody, and welcome to the meeting of the Swansea Public Service Board Joint Committee. I'll go to the item first on the agenda, which is welcome and apologies for absence. Alison, do we have any apologies, please?
Yes, we've got a few apologies from Emma Wollett, Sean Harrop-Griffiths, Martin Nichols, Deanne Martin, Chris Jones and Rob Stewart.
Okay, thank you. And say a warm welcome to Karen Stapleton, who's filling in for Sean Harrop-Griffiths this afternoon. Thank you, Karen. Okay, so I'm not going to do a round robin introduction because everybody on this call knows everybody. So we'll move on then to item 2, which are disclosures of personal and prejudicial interest. Does anyone have any interest they need to declare? No, thank you. So we move on then to item 3, minutes of the previous meeting. Is everybody happy? I haven't had anyone indicate that they're not an accurate record. Are we all okay to approve those as an accurate, true record? Thank you. Okay, and so we'll move on then to item 4, update on actions from previous meeting. Who is taking this item, please? No actions, nothing that's not covered on the agenda. Okay, thank you. So we'll go then to public question time. Alison, I don't think we've had any public questions, but if you could confirm that, please.
No, we've not received any public questions today, Chair.
Thank you, Alison. Okay, so that takes us on then to item 6, Safer Swansea Partnership Annual Statement 2021 from the 1st of January 2022 to 31st of December 2022. And Paul Thomas, it's over to you.
Thank you, Chair. And it's quite encouraging that we must be doing something right, as there's no questions from the public with regard to the annual statement. Anyway, good afternoon, everyone. For those who don't know me, my name is Paul Thomas, and I'm the Community Integration and Partnership Manager here in the Council. And part of the role is community safety and, more importantly, the Safer Swansea Partnership and how we work in partnership. One of the requirements of the governance is to produce the annual statement, and it's the first time we've done it. So I'm not quite sure why we haven't done it in this format before, but I know that we have reported in past years on progress. And I think that, not to say that I am the author, I have just brought together the information from partners, but it does look a lot more professional and better. And I hope that you have all had the opportunity to read it. And I think it's a great opportunity for us to actually showcase and highlight some of the significant work that we have done over the course of the year, but more importantly, reflecting on how we do it in partnership. I think we always put it out there that, you know, partnerships are the answers to everything, but you do have to work hard in partnership because we all have different demands on our individual organisations. But I think this reflects and hopefully provides the board chair some assurance that, one, we are and recognise partnership is a strength and that the outcomes are there for everyone to see. I don't want to go through the whole document because you've had an opportunity to read it. I suppose I want to just really pick up on 2 items, and I know my colleague Mark Breyer from Police is here as well, who may want to also summarise on some of the other areas. But I think for me, one of the key pieces of work that was undertaken through the course of the year actually came from the events of Mayhill, and one of the requirements was that we needed to do some more engagement work with our communities to understand, you know, what is good, what isn't so good, and what we need to maybe do to improve by gaining the confidence of that community that if they have and voice concerns that we can address and work in partnership to deal with them. So the Safer Swansea Partnership undertook, I believe it ended up being 16 community engagement events across Swansea, led by my team, but very much under the Safer Swansea brand. It was very well supported by partners across Swansea. We had some events where they were very well supported by the community, again, not so well, and some where I think probably the weather was too good for people to come to a park and they decided to go to the beach, which I perfectly understand. There were a number of key objectives from those engagement events, apart from putting on something that the community could come to, which was free, and young people could enjoy some of the entertainment that was provided. But two of the objectives that I think I'd like to highlight was, one, it was actually an opportunity for the public to meet Safer Swansea partners, to build those relationships and to have conversations about, antisocial behaviour, crime, what is affecting their communities, and how we could possibly work together to address them. And that leads on to another one of the key objectives, which was that we need to increase confidence in members of our community to report ASB and crime. And so that in the future that we can then assure them that partners will listen and we will look to address those concerns, which I don't think we've been particularly good at. And this is not blaming anyone. It's just that I think we lose sight of how we do that engagement and what that engagement looks like, and what we can then do with some of the knowledge that we have then from having these conversations. And some of the important ones were actually things that lay outside of the partnership's direct sort of involvement with regard to crime. So the things like, what are you going to do about cutting back vegetation in the park, to highway infrastructure? And those things have been collated into a plan that will be shared with services across the local authority to address what was raised at some of these community engagement events. I think they were well received. We were grateful for the ERF funding to enable us to do that, because we didn't have a budget to do that. I suppose then we're sort of a hostage to fortune that there may be expectations on the partnership that we deliver more in the coming year, but without obviously a designated budget, that becomes slightly more difficult, although we are working with ward members that in the event that they are looking to organise local events, that we will be happy to support them if and where we can. And I suppose the other thing I just really wanted to pick up on was the next steps, really. The strategy was up for review. It had been extended for a period of time as partners felt that the current priorities were relevant. We actually had a Safer Swansea partnership meeting this morning where we tabled the new priorities. And I just really wanted to share with you the 6 priorities that have been identified by the statutory partners and others that we are looking to finalise to take forward for our 3-year programme of work. The first one is reducing neighbourhood crime and ASB. The second one is tackling hate crime, community tensions and extremism. Challenging substance use. Reducing reoffending and tackling drivers of crime. VAUDA, SV, and violence reduction, safeguarding those at risk of violence and exploitation. Each of those have key factors, and each of those will have aims and intentions, but more importantly, those will also have, outcomes as to what we are going to do to deliver on those 6 key priority areas. And the next step for us is, once that is agreed and signed off by CMTs and the respective statutory organisations, is to develop then a mechanism for how we report back to PSB, how we report to the steering group on a quarterly basis, and we will develop those action plans to enable us to be able to provide that assurance that we are meeting what we say we are going to do. That's really it from me. I don't want to carry on longer than I need to. I don't know if Mark wanted to come in and provide any sort of summary or overview, but I'm quite happy to take some questions, but obviously I'm not the subject matter expert on all that's in that document. So please appreciate if I can't answer it. I'm not avoiding or dodging the question. It's just that I may need to take it away and ask someone who knows probably more about it than I do. So thank you very much.
Thank you, Paul. Before I open up for questions, Mark, did you have anything you wanted to add?
Just a couple of things. And I think there's been a lot of kind of soul searching within the partnership about how we take what we've done in the last period and we move forward into the next 3 to 5 years. And I think there's a general acceptance, you may agree with us, Andrew, from the conversation we had this morning, that the test of a really good partnership is around outcome and it's around escalation. Them are the 2 things. And I think we probably need to work harder on both, if I'm honest, around getting the partnerships around the table to really work hard on action plans on specific areas. So from the work we did this morning, I'm fairly confident that we can improve on that with the challenges that we've got going forward, obviously. But it's nice to see the partners coming together and reporting on the activity that they've done. But I think going forward, we've streamlined who we are, why we're there, and to ensure that it's not just a statutory partner has responsibility for this bit. It's about these partners to coming together have responsibility for this bit. So it's not just about individuals pushing their own subject matter if they're experts in that field. It's to pull it all together as a whole. So I think going forward, I think we're in not a bad place, but I think there's a bit more focus now around outcomes and around escalation, and using this board to profile some of the challenges that we've got from the ground up to see if we can make some changes. So I think from this morning and from the documents that you've received, colleagues, I think it's encouraging, but there's still some work to do.
Thank you, Mark. Yes, I'd echo that. It was a really positive meeting this morning, and very productive, I have to say. So yes, we welcome regular updates, which will come through this board. So thank you for that. Does anyone have any further questions? I can't see anyone indicating. So thank you, Paul, and thank you to Mark for item 6. So we'll move on then.
Thank you, Chair.
Thank you, Paul. We have Keith Reid with us to take the item Healthy Weight, Healthy Wales. And this is a verbal report from Keith. Over to you.
Thanks, Chair. I've got a brief presentation, which I also have shared recently with the PSB at Neath and Port Talbot County Borough. So with your permission, I'll use that to frame.
Sorry, could I just check? Is that translated into Welsh as well?
It is.
Oh, brilliant. That's great.
Yep, it is. Yes.
Thank you.
And because they knew someone who was going to ask, that'll be the reason why they did it, I guess. So I'll see if I can share. Hopefully right. No, I've done that. Bear with me. I just need to do something else. So hopefully you can see that now. So by way of update, I just wanted to hang this update on the recent system mapping workshops which have been done in the Swansea Bay area. I give an update on where we are in relation to the Welsh Government Healthy Weight, Healthy Wales strategy approach at the moment. I need to, yeah, here we go. So folks will be familiar with this Healthy Weight, Healthy Wales Welsh Government long-term strategy was launched in 2019 and intended to run through to 2030. Clearly, the initial phases of that were disrupted by recent events. So there has been a bit of a hiatus in getting momentum behind this long-term strategy. There are a number of initial priorities which align with some of the align with some of the responsibilities of the PSB, both collectively and individual partners. And some of those initial priorities are around changing the food and drink environment to make healthy choices more easy, looking at the creating active environments to support physical activity, the role that the natural environment can play in supporting healthy weight through both the impacts on food production and also on physical activity, the role of learning environments, both formal and informal, in supporting people to live to have a healthy weight, and then of course looking at the role of inequalities, how we can provide support to individuals with needs associated with their weight, and then providing leadership across the system. So it's a whole system approach, a whole of government approach to improving the levels of healthy weight in Wales. What in Swansea Bay, the current picture is that we've got an issue with overweight and obesity, and that issue is starting at a very young age. So we've got a third of 4 to 5 year olds, children coming into school, are already overweight or obese, with 1 in 6 being obese in the most recent figures, and that's on an increasing trend. We've got a situation where for adults, overweight and obesity is now seen as normal. It's not unique to Swansea Bay, and the levels within the Swansea Bay are similar to the rest of Wales. That's not a reason for complacency. That's a reason for concerted action here. And we're also seeing that there's the expected or the now accustomed social gradient in terms of levels of overweight and obesity, with higher levels in areas of high deprivation and lower levels in areas of low deprivation, more affluent areas. And why is overweight and obesity is the norm? Why is that a problem? Well, it's a problem because it then acts as a risk factor for long-term chronic diseases, type 2 diabetes, cancers, and heart disease. It also impacts on individuals' lives by affecting mental health, their ability to get and maintain employment, and it has an economic impact. So the lost productivity and the direct impact of treating health and other associated effects of overweight and obesity is significant. So it's not that we are picking on people because they're overweight or obese or pursuing a fattest agenda. It's because there are wider societal impacts of overweight and obesity that why we're adopting a societal response to overweight and obesity. I won't spend too much time on this. The key thing for this is, you can see the length of the bar shows the impact of the individual risk factor in terms of the amount of illness it contributes at a population level. So smoking, up there you can see, is far and away the biggest contributor of ill health and disability at population level, and high blood pressure is the next largest. But the diagram on the right is to indicate that if you look at high body mass index, overweight and obesity, in all its realms, so whether it's as on its own, as on the stick diagram on the left, or as a contributing risk factor to other risk factors, then that's the single largest contributor to years lived with disability. So smoking is really important, but so is overweight and obesity in terms of contributing to ill health at a population level. Yeah, I've already touched on this a little bit. All Wales average for overweight and obesity in adults, 62%. Swansea Bay, I said, was close to that, 61%. You can see that Swansea is slightly better, 59% compared with Neath and Talbot. But as I said already, no sense of complacency because of that. Those figures are still way too high. And again, looking at the 4 to 5 year olds, again, we can see a clear differentiation between the proportion of our school entry children who are overweight and obese in Swansea and Neath Talbot. So, a different picture across the region, but again, the solutions to these issues are the same, regardless of whether you live in Neath Talbot or Swansea. I mentioned the link between deprivation. This is just a heat diagram showing the areas of highest deprivation, which we're all familiar with. So I won't spend any time on this, but there are concentrations of overweight and obesity in those areas. This is a diagram which just describes or illustrates in a bit more detail the gradient associated with increased deprivation. So at the top of the topmost bar is the most deprived quintile. This is at all Wales level. The bottom, the most affluent or least deprived quintile. You can see the extent of the difference in levels of overweight, obesity, or obesity on its own between as you move up and down the social gradient there. That's what that's intended to illustrate, and this is a different way of showing a similar picture, and this is relating to healthy eating habits. So adults who report eating 5 portions of fruit and vegetables previous day, by social deprivation, least deprived at the top, so most affluent, and most deprived at the bottom, and the red line is the Welsh average, and you can see over time. Not only is the gap in fresh fruit and veg consumption growing, but overall fresh fruit and veg consumption is declining across all of Wales over that period. And then again, another important determinant of overweight and or healthy weight, physical activity, compliance with physical activity guidelines. And again, this is showing with the deprivation quintiles the other way around this time, with the least. Same way around. It's the participation that is showing lower levels of participation in the most deprived quintile at the top, and highest levels of participation in physical activity in the most affluent areas. So we can see that not only is overweight and obesity distributed across a social gradient, so are some of the contributing factors to prevention of overweight and obesity. There's a social gradient the opposite direction in them, with protective behaviours being less prevalent in more deprived areas. That's not the whole explanation of why those areas have higher levels of overweight and obesity, but it is a contributing explanation. So as part of the Healthy Weight, Healthy Wales strategy programme, there's an alliance been established in West Wales between the two health boards, Health Board to the west of us and Swansea Bay Health Board locally, to do some work on the systems which might contribute to overweight and obesity. We pursued that because we weren't able to get individual networks up and running on a health board footprint. We were unable to attract staff to lead that, but we have managed to successfully recruit a system work leader at a regional level, and they're going to then recruit additional staff to support them in that work. The work that they're undertaking to start with is around a whole systems approach. And what do we mean by that? Well, this diagram looks a bit like a plate of spaghetti. Those of you who may remember something called the Foresight Report into Obesity, this is a diagram that was produced by that group, which showed all the interconnected influences on an individual's weight. So this diagram represents all the factors, the system factors, which lead to someone being the weight that they are. So at the center, right at the center in the darker orange things, there's a statement of energy balance, and that fundamentally people put on weight or lose weight because they either eat more than they expend in energy, or they eat less than they expend in energy. This diagram captures all the influences on that energy intake and energy balance. And you can see that it's some of those are individual factors at the center, and including the physiology of an individual, their body makeup, the psychology, their behavior and attitudes, their physical activity. But as you move more, and their food consumption, but as you move more peripherally in this diagram, you'll see that other factors are also playing a significant impact. So that's food production, the type of food that's available and the quantities of food available, the social psychology, the community in which the individual is existing, and the cultural and other influences on them, and the physical environment in which they living, learning, working and playing. So how they get about, how conducive to undertaking physical activity their environment is, or how sedentary the environment encourages them to be. And part of the work that we're being undertaken at the moment is mapping what are the different effects of those across the system on individuals in Swansea Bay, and then also beginning to identify subsystems such as those outlined here and again in Welsh that might be suitable for us to intervene in to help to influence in a more positive way the weight in our communities. I'll stop sharing there. Just a couple of other things I'd like to say. There was a workshop, whole systems mapping workshop, which was led by Leeds Beckett University, which happened locally just the last week in January. And that was about trying to, from an individual informant perspective, get into some of the local influences and start to do that system mapping from a local perspective. And that identified issues such as physical activity in children, active travel, access to healthy food, and cooking ability as some of the issues which have been identified locally as contributing to health, overweight and unhealthy weight. And that also undertook something called social network analysis, which is beginning to identify people who are in a position to influence behaviours in local communities, either because they control particular aspects of the health of the food system, or because they're in an ability to influence the behaviour of individuals who live locally. So that work is being commissioned from, as I say, from Leeds Beckett University. It's part of a programme of work which is happening in all health board areas across Wales. And then following on from that, there's going to be identification of specific subsystems to look at. And each health board area, and in our case, the South West Wales area, will be doing some more detailed work on a particular subsystem, and then be able to share the findings of that with other health board regions in Wales, as they will share their findings with us. So the idea is to start to build up a better picture of what are influencing weight in Wales, where are the points which are suitable for intervention, and how we might start to then begin to change the food environment in Wales and activity environment in Wales in a positive way to help to tackle this issue of overweight and obesity. So there will be further, there'll be an emergent report, there'll be further updates as this work continues, and there's also plans for additional work, and there is additional work going on, both working with individual people as part of a clinical or supportive approach, and also looking at other aspects of nutrition and physical activity regionally. So that's just an update, particularly on the whole systems approach at the moment. Sorry, I did go on a bit there.
Thank you, Keith. Does anyone have any questions for Keith on this report? No, I think, sorry, Amanda, going in.
Yeah, not so much a question, I suppose more of an observation. Keith, SCVS led for a project that went on for 10 years, actually, mainly funded by Big Lottery, which, I mean, what you've just gone through just feels really incredibly familiar from that, although the project was preventative rather than linked into obesity directly. But our learning from all of that, and the project went into people's homes, actually, because I think there's lots of factors that you only see when you're actually in an environment where people are living and cooking. The project linked physical activity, nutritional information, as well as cookery skills, which we added in because that became really evident that, you know, there was a gap there in terms of how people could sort of approach this, and then how just the sheer impact of poverty on it as well. So the project, it was a volunteer involving project, and it went in 2 families. We had dietetics involvement and training for the volunteers, so it was very much linked into appropriate health messaging. But we'd go in and do information and activities around those key areas of physical activity, nutrition, and cookery skills, bringing it together because we recognise that all of those things interface with each other. You know, but we'd go in and see a family, you know, sit down and maybe try and start to talk about, you know, what the family liked doing by way of physical activity, maybe, or did they know where their local park was? Had they accessed, you know, passes for the local leisure centre, that kind of thing, and then realise maybe that they didn't actually have a working cooker or a fridge, you know, so the things that they were eating were very much also about the equipment that they had available to them. So the programme tailored, for example, in relation to cookery skills, or in relation to, you know, children and young people, physical activities around whether the family had a ball to play with, whether the family only had one pan. It was a whole population project at the stark end of poverty, and something to unpick factors that were not obvious when we were receiving referrals, either from GPs or you know, other health professionals. And then, you know, sadly, we also did stuff around putting meal planners into, so working with the food banks around putting in meal planners so that people could look at what was in a food parcel and work out what they could do with that would be a healthy meal. So sorry that I'm recapping and taking a little bit of time on that, but I just think that our experience, and it was heavily evaluated, and you know, more than happy to share all of that stuff with you. But some of those social factors were as absolutely important as some of the you know, kind of more definable as clinical factors, I suppose. And a huge role from my perspective, if we're talking a partnership approach to this, you know, that the third sector connects hugely with people based on that mentoring and absolute understanding of people's personal circumstances. So really happy to see this work happening, but just hoping that it doesn't have an entirely clinical focus, I suppose.
Do you want to come back on that, Keith?
Yeah, and I think I'm really grateful for you raising that, Amanda. This work is absolutely not focused on clinical, and although there is a strong direction from Welsh Government that we need to have treatment pathways in place for those who have problems with overweight and obesity. This is not a problem we can treat our way out of. You know, we do offer a range of clinical interventions, including including surgery for obesity. But even if I was to be able to wave my magic wand and stop anyone from becoming obese, anyone else from becoming obese from today onwards, at the rate we currently do surgery, and surgery is reserved for the most extreme cases of obesity. It would take us 30 years to get through the current numbers of people who are eligible for surgery. So it's not that you're absolutely right. The answer to this is not clinical. It's not more clinics. It's actually addressing the issues that you've raised, which is enabling people to have access to the skills required to understand and provide themselves with good nutrition, themselves and their families, and undertake appropriate levels of physical activity. So it has to be about identifying the barriers, such as the ones that you enumerated there, and putting in place measures to remove them, whether that's in a household or whether that's in a physical environment or a community, or indeed when they go out shopping, to make sure that actually what's being presented to them by the supermarket is not being presented to them because it's going to maximize the profits of the supermarket, but because it's actually going to maximize the health of the shopper. But that's a whole different ball game. So yeah, I'm very supportive of that, and I will encourage those engaged in this work to follow up with you on that.
Thank you, Keith. There is something which I think, from my knowledge and perspective, does link nicely with this agenda as well. As a school governor, one of my schools were engaged in a project called FAST, which was, I'm sure Jane Whitmore knows about, which was families and school together, but very much centered around food and learning the skills to cook food. But whilst doing that, you know, a healthy agenda, healthier food, budgeting for food, also an opportunity to engage with families and bring children and parents closer together. It also helped tackle isolation. There was a single parent who hadn't made many connections in the community, and through that project actually made some really positive friendships and connections with other parents. So, you know, there's a lot of you know, added benefits as well for this agenda, not just around tackling obesity. There are a lot of things linked to it in terms of helping with social issues. I bring Jane, did you want to come in on this particular item? Because I know this project was so successful, our school decided to continue with it.
Yeah, if you don't mind, Chair, if that's okay, absolutely. I know it's been running in various different schools across Swansea, and it is exactly as you described, Andrea. There's also the and Keith will know this about the healthy preschool work as well that goes on in terms of that healthy the healthy environment and healthy eating for the really little ones, so that encourages their good behaviour or good eating habits of why it's important to cook together. But it does have huge added value. It's not just about the cooking, it's about the connections and the attachments in terms of parenting and how that goes through, and thinking of the early years, thinking of the schools, and then into our young people. But then the other side of it is a lot of the loneliness and isolation that comes in around activity, and thinking of the Aging Well agenda and how just getting out and about and actually be around that preventative agenda, being able to get together and walk and things like that, low level prevention activity, it all feeds into it. But I just wanted to pick up on Amanda's point in terms of the access or the equity about, can people cook, or are they able to cook, around the poverty agenda, because it comes in that way. And so it's really good to see and hear the presentation, Keith. I thought it was really interesting, because when we get Welsh Government grants, for example, and we want to, direct them to society to help with cost of living, like what they would call white goods and equipment, is if you've only got one ring, or you can't afford to put your gas or your electric on, it's all of those things. So it is a whole system approach, isn't it? It's not just a clinical. As you say, so one of your first slides is around the health, the mental well-being as well, about being out and active, tying in nicely with the environment. So it's a really good cross-cutting. Lots of examples, I think, that you could take from it to actually say what we are doing and how we join it all together to actually make a difference. It's quite shocking statistics when you think about it, especially the little ones, the younger children. But I guess that's from us all being sat in house. So really important in terms of those open spaces and physical activity. But really, really good, Keith. I enjoyed seeing that. I think it'd be helpful.
Thank you, Jane. And Karen, you've been waiting patiently.
Sorry, Karen.
There was only just an observation. I think the data that Keith presented was really quite stark, wasn't it? But I did notice, Keith, that some of it was like 10 years old, some of the statistics. I just wonder what it's like now, post-COVID and cost of living. It can only be worse, can't it? Which is even more worrying, really, isn't it?
Yeah. I think there's, we've talked a little bit about, the cultural importance of food. That FAST project, I think, also is an example of that. Food is really important in most cultures, and so behaviours around the preparation, the cooking, and the eating of food are important and are changing. And some of those are starting to break down. So the idea of sitting down together as a social unit and eating together, that's something which has been broken down, and that's changing patterns of consumption, and it's also having other social impacts. And then the other element is about I guess is maybe about the economic driver. So food production is now seen as a big economic engine, and some of the food production side of things is, and food processing in particular, is not necessarily oriented towards food as nutrition. Some of it is oriented towards food as leisure, and you could think of fast food outlets as being an example of that. Many fast food outlets are busy at times which are not meal times. It's because people they're not eating for nutrition, they're eating as a leisure activity. So there are significant behavioural, cultural, societal changes which also need to be tackled as part of this agenda as well.
Thank you, Keith. Can't see anyone else indicating, but appreciate the presentation. If it's possible, I think it might be helpful for members on the call to perhaps share the presentation following the meeting.
Happy to do that, yeah.
I know that the spaghetti plan was very small. I couldn't read many of the things on it, so that would be appreciated.
I'll share a separate version of that. The one on the slide you won't be able to read, but there is an expandable one, which means you can read even the tiniest text. So I'll make sure I put that in the email.
Thank you. That would be very welcomed. Okay, thank you. So that takes us on to item 8, local wellbeing plan update, and we go over to Susie Richards for a verbal update. Over to you, Susie.
Okay, that's fantastic. Thanks, Andrea. Councillor Lewis. The local wellbeing plan, it's continuing to evolve in response to the consultation responses that we're receiving and processing as we move forward. The joint committee was last circulated, the most recent iteration, on January 31st. The most recent version will circulate following meeting, and we'll also circulate a list of changes and the rationale, but that is all literally changing on a day-to-day basis, which is why we weren't able to submit it for the meeting today or go through that that publicly. But for information, you know, we'll keep you in the loop on that. The document itself will sorry, yeah. So responses are expected from NRW, the Health Board, and Welsh Government yet. So those are still forthcoming, as well as a small number of responses and public surveys that we expect to receive over the next 3 to 4 days before closure. So all responses to date have been processed already. We were keen to meaningfully act on the results of the consultation and the ideas that we collected. So we've been doing that as we go along, rather than in one fell swoop at the end. Although obviously we'll be presenting an overview of that final data next week. The Joint Committee has a extraordinary workshop based meeting next Wednesday 15th, and that's going to agree those final changes or comments or additions that you might wish to make after the consultation period. And more importantly, it'll also recommend the plan for organisational sign-off, so we'll need to be quorate at that meeting. And we'll walk through the plan page by page, and that'll enable you to consider any further changes suggested at scrutiny on the 14th of February as well. So I'll just go through the consultation responses to date very briefly. Responses to date have been disappointingly low in comparison to expectations in other years for the wellbeing plan previously, or indeed other consultations at a similar strategic level. It's been recognised, and we put a recovery plan into action in January through the planning group. That included relaunching the survey via social media. We went through partner comm teams again. We resent to all our contacts. We arranged some additional events, and that included engagement at the Waterfront Museum's Wellbeing Fair. We did some input gathering sessions at Welsh Language Flying Start session. We've done an engagement workshop with the GP clusters. And that's in addition to drop-in sessions, which we ran at Swansea Museum, Clydach and Central Libraries. We ran an interactive event at Swansea Children's Rights Day, at Swansea Human Rights City launch presence. We've conducted other social media, and we had quite a bit of evening post coverage, as well as internal and external marketing by partners. So to date, we've had around 115 formal responses to the survey, as well as, gosh, hundreds of ideas and comments from members of the public, all of which have been logged and have been collated and put into categories. At the moment, just to give you a flavour, about 60% of members of the public, about 35% of Swansea Council employees. No one's currently completed the survey in Welsh, although we did target Welsh speakers, and we sent it through Mentor Iaith as well. So that's a bit disappointing so far, but could change. 70% roughly last time we dipped into the data had read the plan, and of those, reassuringly, well over 70% at a minimum agreed that the plan was easy to read, accessible, informative, and at appropriate length. So we feel reassured that the plan is in line with meeting people's expectations. Over 90% agree with our wellbeing objectives to date, and that's been fairly consistent throughout the consultation period since November. And between 70 and 90% roughly, they tended to agree with the draft steps. So we are we're sure that we are looking at the right areas of focus going forward. So that's, again, unlikely to change between now and the end of the consultation dramatically, I'd suggest. About 50% of the people doing the survey submitted ideas about how public services could work together to improve well-being. And these suggestions overwhelmingly related to specifics which are maybe best addressed at the action planning phase. So what we did was to code those so we can address them either within the existing steps, or we reference wider level. We look at how they impact the PSB at a wider level of reform. So it's where we look at the ways we work, which aren't specific to the plan itself. They don't need immediately addressing, but we would be focusing on those as in around March we move into the action planning phase. There were some points made which have already been integrated into the plan's development via interim analysis of our responses, and some of which haven't been appropriate for the plan because they're out of scope or they're more statement-based comments, so they weren't applicable. But the majority very much around the actions themselves. So most of those will be rolled forward and actively used at the next layer down of operational action planning, rather than at the very high level strategic level where they echo the more overarching themes within that plan. To update you, an easy read version of the survey was also commissioned. That's attracted 14 responses to date, as well as input again, more ideas, which were collected at 3 workshop sessions run by West Glamorgan People First in various settings. All of the inputs agreed, like with the main survey, that our objectives are the right ones to date. And the ideas again tended to relate mostly to issues best addressed at action plan level. So I think they're going to be things which we'd want to directly feed into action plan development throughout March. And that's also true of ideas collected at Children's Right Day, the drop-ins and the events. All of those have been collected and will be collated to give a direct line through to the right stage of operational implementation. Moving forward to when the plan is signed off, we're thinking now about communication of the plan. Our regional fund is already investing in translation. We will be taking forward an easy read of the finished plan, which will be co-produced with West Glamorgan People First Your Voice Advocacy. We're also engaging with a supplier on a digital video of the plan. So that's all in track. We'll also be looking at updating the images and the typesetting of the plan. And the idea is that we'll be able to use those images over and over for the next 5 years whenever we're presenting the plan, in order to paint a picture and engage people. The idea is that they're going to align with the One Swansea logo and the blue and gold colours that we already have in train. And we propose that we kind of brand our communications over the next 5-year cycle in line with that existing palette. The planning group are currently taking this forward. And I did have a question for committee's discussion to inquire whether you wish to delegate decisions around this to the planning group, or whether you would like to be informed and agree perhaps via email, because some of those decisions will fall outside of scheduled meetings, or perhaps those interested would like to form a subgroup. I'm not sure how you would like to proceed there, so that would be useful. I'd be pleased to take any questions on where we're at so far, or the process overall. Thank you.
Shall we start with that last question that you asked, Susie, to begin with? So how do members feel? Do you want to be engaged? Are you happy to sign things off by email? Do you want to delegate it to the planning group? I'll take your views. I can't see anyone indicated. Personally, Susie, I'll bring you in first, Martin. Martin? You're on mute, Martin, sorry.
Again, thanks, Chair. Yeah, you should be getting a response. I signed my response to Swansea a couple of days ago, Susie, so it's on its way, okay? it's a letter to you yourself, Chair. So with an attachment on it. So look out for that. Probably we should do it together, should we? I don't know. I guess signing it off, because each of the 4 core members, statutory members, have got roles for signing them off individually, of course. And I think we need to apply some consideration to any variances in those, if there are any. I guess we've got 13 in NRW to approve, for our board to approve. We've got an internal process to do that, and Swansea's in the mix there. We're scheduled to look at Swansea's, and the board, that is, they have a delegated subcommittee looking at it from our board, and that committee is going to look at it at the Swansea draft plan to sign it off in, I think, the second week of April. So it'll be in time for legally and everything. But it probably ought to come together, should we? I guess, because there'll be each of us. We've got 13 to do of the 15 PSPs. There are 13 wellbeing plans for us to look at, and others have got 1 or more. I'd say we need to do it together in case there are any late issues there ought not to be.
Thanks, Martin. Roger?
I feel embarrassed now. We've only got 6, but I should have gone first, really, shouldn't I? Yeah, we have a letter in draft ready to go. As you can appreciate, it's been quite a busy period in the Fire and Rescue Service recently, with preparing for potential industrial action and the like. So, yeah, we have a letter in draft ready to go, but it does say we'll be in support. I think as well, I'm with Martin. I think we should be cited to come back and look at things as a collective, rather than delegate it either to a committee or do it via email. I think I'd rather have that conversation around individual items. Yeah.
Thanks, Roger.
Oh, sorry, could I just clarify? Andrea's question was around very low-level branding decisions, not the signing off the plan itself. The plan will be signed off in person or discussed, actually, discussed, and these issues walked through page by page, as it was last time, at a extraordinary meeting in a week's time. Following the close of the consultation, which is the reason that we've been processing as we've gone. And we've worked very closely with NRW on their comments to date, so that there are no surprises. Same with Welsh Government. We haven't received their feedback, but we've had very positive informal feedback, and they were able to give us a steer as to what needed to be worked on. And a lot of the changes that we've suggested are made so far have come from those sources. Sorry, just to
Thank you, Susie, for the clarification. Ness?
Thanks. I'm grateful for that, Susie. I was thinking I was on the wrong page there. So the question you were asking us is whether or not we want to collectively agree any kind of branding around the plan, or whether we're happy to delegate that to the planning group. I think, given that the branding is going to last potentially for 5 years and be used kind of continuously through that process, I wouldn't mind a look at it, I have to say. But I don't want to, make it a bureaucratic process. But that would be my initial view.
I would agree with that, Ness. And I think from what Martin and Roger was saying in terms of sign off, I think we could quite comfortably do that by email, I think, just for ease, but it would be good to have sight. So thank you for that. So following that, then we'll open it up for any wider questions in terms of the consultation as it's been run so far. Anyone wish to raise anything? Ness?
Just to say, it is disappointing in terms of the level of response, but just to say thank you for the team, because a lot of effort has been made to try and improve that response rate. And I know, we went round a second time and we've really tried to stimulate that interest. And I don't know, but colleagues Martin and Roger may have experience from other PSBs that have had the similar experience. I think it is getting increasingly difficult to get public engagement around these sorts of documents. And if it's any consolation, the response rate on our corporate plan has been similarly disappointing. So I don't know if there's anything else we can do next time round, lessons learned, but I think it is just something that organisations generally are finding more and more difficult.
Yes, I would echo that, and I'd also echo the thanks to Susie and the team. I know that Susie has been in several forums and meetings that I've attended and tried to encourage engagement and feedback on the plan, but it is very difficult, but it's not through lack of effort. So thank you very much, Susie, for everything you've done. I know you've touched upon a number of things. I think in addition to that, there was the 50+ network, the Tackling Poverty Forum, the community and town councils, and that's just to name but a few. So you've really been doing the rounds trying to get people to engage with this plan, and it's very much appreciated. I think it was Jane first and then Roger.
Thank you, Chair. Just to echo really a big thanks to Susie and the team, which is I know my lot have been doing their bit as well with you, but I guess it's really how we think about how we engage with communities going forward. I mean, we picked up on it, we were talking about it in community safety this morning, but it's a theme right the way. I think everyone's exhausted with consultation. What do we do and how do we do it differently? So in terms of almost like cross-cutting themes, what is it, how do we need to be engaging with our communities or the general public around what matters? It's really tricky, but it is a huge piece of work, I think, for all of us. And you know, the response, yes, it's disappointing, but I'm not surprised because of that's kind of the standard, the amounts that we get back. But I think in terms of going forward, it's something that we need to think about, because I guess we can do it, but if we manage to do it together rather than go out over and over again, people get fatigued of being asked, don't they? And it's what difference does it make? So just a thank you, Susie, from me, because I know it's been really difficult, but yeah, thinking about how we do that going forward is it's a tricky one.
Yeah, thank you, Jane. Roger?
Yeah, just to reiterate, I'm sure all partners find it really difficult and certainly from our perspective. So we cover some 900,000 people, just not short of 1 million, and our responses are pretty disappointing year on year. However, when you come to make some significant change, then that's when the public get engaged. I think, you know, if you're looking to close or remove something, then, you know, it's the negative stuff. So I think we can, you know, derive some sort of positive message that, you know, people feel really reasonably comfortable. I know that's perhaps not an accurate measure, but I think if we were doing things wrong, I think, you know, people do feel compelled to engage. And I think it's reflective as well across the 6 that we cover as well. So I don't think we're out of step with that as well, which should give us some comfort as well.
Thank you, Roger. And I think Amanda makes the point in the chat that there was a huge amount of co-production in, you know, with people being involved at the very early stages, which could reflect on the fact that people don't disagree with the plan because they've had greater involvement at the start. So you could look at it as a positive, actually. Karen?
I was going to say the same thing. I think, you know, that involve people in the development is probably more important, isn't it? And it could be a measure that you did that well, which it sounds like. And then, you know, as long as there's plenty of time allowed in that development space, and then involved now in the delivery space as well, I think, Suze, isn't it? And making sure we've got the right partners at the right levels in that space. Yeah, it shouldn't necessarily, it might not necessarily be a bad thing. Yeah, Chair.
Thank you, Karen. I can't see anyone else indicating, so thank you, Susie, and we look forward to going through the plan in greater detail next week. But thank you for all your efforts and very much appreciated. So we'll go on to item 9, performance framework, highlight reports from the 4 work streams. Clearly a lot of information there, so I'm not going to go through it in detail, but just opening it up. Has anybody got anything by exception that they wish to raise? No, thank you for that. There are on then to items for information. So item 10 is the support for public service boards 23-24 to 25-26 and the future work programme. Anyone wish to raise anything? They're only items for information. No. Susie, no?
Yeah, just briefly. The next grant allocation regionally, which is for around 58,000 across the region, that's looking at focusing on strengthening community engagement and involvement. And well, it looks at how PSBs can engage with communities more effectively. It also suggests that we look at maintaining a data portal, which is the other thing. We wondered if there was any ideas in terms, perhaps thinking about the conversation that you just had around whether looking at perhaps a performance-related co-production project might be worth considering, so that we have an ongoing way to feed back about perhaps a couple of PSB projects as a starter for 10. Something we could maybe pilot with Neath Talbot, or maybe look at other ways of engagement outside of standard survey going forward, as a way to involve people in what comes forward with the action planning as well. So it was just to sort of flag that, because we are going to need to take something forward within the next month in general terms, but we wondered if those were the sorts of directions which might pique your interest, given the situation that we've just discussed.
I suggested, Susie, perhaps if people take that away and give it some thought, and maybe bring it back to next week's meeting, if they have any ideas or suggestions to feed in. Everybody happy with that? That's great. Okay, thank you again, Susie. I've got one very swift item of any other business, and it's ironic you're talking about consultation fatigue, because this is exactly asking for some input into a consultation. So we've had a letter from Karen Jones, Chief Executive, South West Wales Corporate Joint Committee. They have their draft corporate plan and its associated documentation. The closing date for submission of comments is the 8th of midnight, almost on the 8th of March. So I'm going to ask Leanne to circulate that letter with the enclosed links to all of you. And if you do find some time to give an input into that consultation, I'm sure it will be appreciated. So that just leaves us then to the next meeting, apart from obviously the one next week, which is an extraordinary meeting, and that will be on Thursday, the 27th of April. So thank you very much for your attendance and for your input and contributions, and always your ongoing support. Thank you all for your attendance today, and have a great day.
Thank you.
Thank you. Bye.
See ya.